In terms of age and fertility, there is something called age-related fertility decline. So, we're born with all the eggs we're ever going to have, and we carry them around with us everywhere we go, and they're exposed to everything that we're exposed to throughout our lives. And then as we get older, so when I say older, I'm saying, I don't know, mid to late 30s, into the 40s, etc. When our eggs meet the sperm, and the chromosomes are supposed to rearrange and mix, right? Well, as the eggs get older, they don't do that part as well anymore. And so what ends up happening is those offspring or those embryos don't have the right number of chromosomes. And so that can result in either infertility, like a difficult time getting pregnant because that pregnancy is not genetically normal, or sometimes can result in miscarriage. And so with a decrease in fertility and increased risk of miscarriage, what that means is overall your chance of having a baby is lower as women get older. It goes down slowly first in the mid-30s, and then the late 30s a little bit quicker, and then after 40 it can go down quite a bit. And so we definitely see this impact of age-related fertility decline when we look at IVF outcomes. And we can see that probably the biggest determinant factor of success with IVF is the age of the woman who's giving the egg. And that is just because of the risk that the egg is not going to give us a genetically normal pregnancy, which then would continue.
We want to try to make IVF more efficient and more effective by trying to understand which embryos are genetically normal. And it's very important that we understand what this genetic testing can actually do. So doing PGT-A, for example, which is probably the most common type of genetic testing of embryos, has to do with seeing if the embryos have the right number of chromosomes. So over the years, literally over 15 years plus, there have been different variations of this test. Now we do something called blastocyst biopsies, which means that the embryos are biopsied on day either 5, 6, or 7. Most of the time, depending on where you are in the US, but at least in Ohio, there are not any clinics who can do the testing in-house. So the embryos get biopsied, the embryos then get frozen, they stay at the clinic, and the cells get sent for analysis. And then you'll get a report, or your physician will get a report, somewhere around 2 weeks or so later, letting you know which of the embryos have the right number of chromosomes. And it's actually quite specific. And then that information can be used to help you and your physician decide which embryo should be transferred, if any. So this is a great idea in theory. The idea is that we can somehow help people have a higher chance of getting pregnant. But it's very controversial, and there have been lots of studies over the years trying to understand exactly who benefits from this. So sometimes people will consider it if they are in their mid to late 30s. So for example, it hasn't really been proven to be overall effective for women who are less than 35, because those women already have a very good chance of having chromosomally normal embryos. So sometimes people have other reasons for wanting to consider doing genetic testing. Sometimes they've had a history of recurrent pregnancy loss and think that that may decrease their chance of having a chromosomally abnormal pregnancy. Sometimes they have had an experience where they've had a chromosomally abnormal pregnancy before. And sometimes they are concerned about their age, and maybe those patients only want to have one embryo transferred, and therefore they are trying to make sure that one embryo is genetically normal. So there's a lot of different risks and benefits of doing that testing. It can sometimes be more expensive and often not covered by insurance. There could be a theoretical risk of a negative impact on the embryo from the biopsy. So it's really important that you talk with your clinician or physician about whether it's right for you, and you have a very honest conversation about the limitations and the benefits for you specifically in terms of the testings.